going to be discussing H. pylori, and H. pylori is a chronic stomach infection of worldwide epidemic proportion. Basically, it gained its notoriety because it would cause stomach ulcers, and those stomach ulcers would be bleeding, horrible, painful ulcers. And eventually, those stomach ulcers, if they keep reoccurring and if it keeps going unabated, it will become the stomach cancers. So usually with H. pylori, it loves to live in a low acid environment. We want a very acidic stomach. The pH of the stomach should be around 1, 2. When that acidity starts to get up to, 3, 4, that's when we are living in a low acid state, and that's our first line of defense of killing these infections, specifically H. pylori. Because like I said, H. pylori likes to live or thrive in a low acid state. So let me repeat that. A Helobacteria, an H. pylori, survives only in a low acid state. The most common reason for a low acid state, for low stomach acid, HCl, would be a zinc deficiency. So when you're chronically low in zinc, you're chronically low in stomach acid. So one of the great strategies for dealing with H. pylori is mineral balancing and addressing the zinc status. Because like I said, to make stomach acid, you must have zinc. That is one of the main players in the production of stomach acid. Now, when someone does have H. pylori, we will address it with nutritional support to help heal the gut. We will use homeopathic support to address individually the mind-body symptom connection, to get the energetics of this virus in check using homeopathic support, as well as using the Rife protocol. So the Rife machine, we set the protocol to the H. pylori frequency, which zaps the bug, and we would do a few applications of that over time to address it while doing mineral balancing, while healing the gut, while addressing the patient's constitutional with homeopathic support. Now, another thing about H. pylori, that most people really don't even develop ulcers, so that's something that we need to keep in mind. We always have to have the whole picture, and we want to just remember some of the two most common reasons for the overgrowth of this bug is low stomach acid and lack of good bacteria. So we keep this stuff in mind as we're addressing the H. pylori bacteria, which again can be a very problematic creature if we don't deal with it. But at the end of the day, it loves to live in a low stomach acid environment. And again, the number one reason for low stomach acid is a zinc deficiency.